Oh, hello everyone. On behalf of my colleagues, I have the privilege to say something about our smoking prevention program. First, I declare no conflict of interest, and these are our learning objectives. Hopefully, you'll be able to determine two social determinants of health, two aims of our programs, and at least one effective method of smoking prevention in our country. So everything has started quite spontaneously in 2019 during AACE meeting, when we had a chance to hear a presentation from Dr. Charles Moore, and seeing such behaviors on regular basis among medical students or medical professionals. So we wanted to evaluate the scale of the problem and see whether our observations are reflected in numbers, and unfortunately it turned out they did. So in results, we implemented smoking prevention program dedicated based on tobacco prevention toolkits from Stanford University, dedicated to elementary school students, and standardized US curriculum was the core of our initiative. The program was funded by RISE grant. We received IAB approval, support from head of elementary school. We done pre and post tests, both for elementary school students and medical students who conducted the program, and all necessary data were collected in REDCap. Also, we received strong support from local organizations like Polish Society of Oncology, Cardiology, Public Health, our Silesian Governor Office, AACE, and many others. So the program was held in a small village called Tyniec Mały. It's like about 2,000 citizens. And for this purpose, we've chosen a 5-session sample curriculum offered by Stanford University. For each session, and free research assistance. So quick look at the timeline. So everything has started with RISE grant in October 2021. Then we had a time for organizational aspect, workshops, first follow-up, and the second follow-up in June 2022. So we wanted to, for us, the most important goal was to generate change in smoking intention, also boost knowledge about the various effects of smoking, test effectiveness of the curriculum within Polish school system, and generally speaking, promote anti-nicotine lifestyle. So the workshops were held in school gym for a group of 25 to 30 students. Everything has started with PowerPoint presentation, then we had Kahoot quizzes, workshops, and Q&A session, and time for a discussion at the end of each workshops. But in the meantime, Russia invaded Ukraine, which created huge refugees crisis, and Poland became major destination for refugees. So in addition to that, quite spontaneously, we didn't plan it in advance. We've done additional workshop, except for Polish-speaking students. We also chosen 1-session sample curriculum offered by Stanford, and we translated curriculum into Ukrainian by native speaker. So we've done sessions and workshops for Polish-speaking students as well as for Ukrainians. So we created offer questionnaires consisting of socio-demographic data, smoking intention questions, knowledge about the topic, and main pluses and minuses of the program. So we've collected data and prepared statistical analysis. And in terms of results, we're happy because we could observe after program completion decrease in smoking intention, also boost in knowledge about adverse effects of smoking, promote a nicotine lifestyle, and met, generally speaking, stated aims. In terms of limitations, we can say that our study group was quite small, about 120 students. Also, some topics should be modified to better align Polish circumstances, and some topics were repetitive between the sessions. Yeah, so because our program was ranked among 3 the best in the region, we want to expand our initiative into other schools in the region, and also register our program in the clinicaltrials.gov.com. We submitted papers to the JCE, and since we receive all materials and curriculums from Stanford University, we want to share our translations with Stanford and share our data as well. So to conclude, our program has stated aims: increase students' knowledge, empower students to touch on the topic with others, and generally speaking, effectiveness of US curriculum within Polish circumstances was quite satisfactory. So students' knowledge about the topic is limited. There's serious demand for similar educational intervention. Program, however, should be modified and adapted to local environment, and it needs to be expanded into other schools of the regions. So in the words of Jim Rohn, the change doesn't happen by chance, it happens by action. So don't wait, just act. I want to say for the very end to all people involved in our program, starting from senior investigators, I want to thank for their mentorship, as well as I want to thank to junior investigators who's done amazing job and done all the translations. So for the very end, save the day for AACE meeting next year in Birmingham, UK, and thank you very much for attention.